Experts say that since the 1960s, hip replacement surgery has been one of the most important surgical advancements. However, the latest breakthrough in hip replacement includes minimally invasive operations, surgery with smaller incisions that can provide patients with quicker recovery time and the freedom of more mobility sooner with less pain and discomfort. 51-year-old Simone Azure enjoys playing flag football with her teammates, the Fridas. Simone has always been active, starting in her early 20s. She studied martial arts, and she says it helped shape her into the woman she is today.
Getting the black belt was the first thing where I realized that you put in work and you could get results, and it changed everything in my life. It changed my ability to public speak, my confidence. And today I have a third-degree black belt.
While Simone was involved in several different sports throughout the years, she admits she felt aches and pains in her hips in her early 40s, but didn't give it too much thought. Gradually, over the next 10 years, the pain got worse and worse.
My hips started to feel like they were getting tighter and smaller and tighter and smaller, and so my mobility was greatly restricted. I played football last year, but at the end of the year I couldn't run in the games or anything.
Eventually, the pain got so severe, she even felt it while sitting.
It would feel like somebody had taken an ice pick and just jammed it in my hips.
Hello, good morning, Simone. How are you?
I'm well, thank you.
Dr. Richard Berger is Associate Professor of Orthopedics at Rush Presbyterian, St. Luke's Medical Center in Chicago.
When you get arthritis of your hips, at first your hips become stiff. It becomes difficult to get on your shoes and socks, get in and out of a car, in and out of a booth in a restaurant or a theater. And as time goes on, that stiffness turns more into pain. And it can be very mild pain at first, so just pain when you're doing lots of activities. It then progresses to pain when you're walking, pain when you're sitting. Then the worst is pain when you're sleeping.
Painful, stiff hips can limit a person's ability to walk, sit, or lie down, or even get in and out of a chair. But even if arthritis has developed in a person's hip, it can take years before he or she feels any pain or discomfort. Not surprisingly, the hip is one of the body's largest weight-bearing joints.
You know, when you're standing still, there's about 1 times your body weight across the hip. So if you weigh 200 pounds, there's 200 pounds. When you start to walk, that increases to about 3 times body weight, or for a 200-pound person, about 600 pounds. When you climb up stairs, that can be 7 to 10 times body weight. So almost a ton of pressure for a 200-pound person can go across your hip joint.
Here's how a normal hip works. The hip has 2 main parts, a ball or femoral head at the top of the thigh bone that fits into a rounded socket called the acetabulum in the pelvis. Bands of tissue called ligaments connect the ball to the socket and provide stability to the joint. The bone surfaces of the ball and socket have a smooth, durable cover of cartilage that cushions the ends of the bones and enables them to move easily. In a healthy hip, synovial fluid lubricates and almost eliminates friction in the hip joint. When all of these parts of the hip work together in harmony, people can move freely. However, when arthritis sets in over time, the ball and hip socket can rub together, called bone on bone, causing severe pain and stiffness. The pain can often increase to the point that some patients might need a cane, crutch, or walker to help them get around. But doctors say with all the options available today, there may be little reason to get to that point. However, there can be some anxiety involved for patients in the decision to have hip replacement surgery. Simone learned to cope with the pain, but her daily routine was becoming more and more limited, and that interfered with her ability to be on the field with her teammates.
You start to live with it and you start to get used to it, so you don't there's no defining point. I know that I wouldn't have been able to play football this year because last year at the end of the year I was pretty much done.
So we did both hips, so one was 5 months, one was 3 months ago. And
after seeing several different specialists, Simone met with Dr. Berger, and less than 4 months ago she received surprising news.
Dr. Berger came in and he said, well, you essentially have bone-on-bone arthritis. That's the good news. The bad news is there's no cure for it, which, you don't really want to hear that. You mean I can exercise until I'm blue in the face and nothing will help? Correct. And so then we progressed to the next step on talking on what my options were.
The most common cause of chronic hip pain and disability is arthritis, and one of the most common ways to permanently treat it is through surgery.
Hip replacement surgery is mostly done for osteoarthritis. That's wear and tear arthritis. That's about 95% of all the hip replacements done in the country.
Most of the physicians were doing the typical hip replacements, and I was nervous. I mean, I wasn't nervous about it. I never was nervous about the surgery. What I didn't want is I didn't want to have to be laid up for 6 months or 9 months trying to rehab.
Once patients get severe enough pain, they usually will want to have a hip replacement, although many patients will wait, and they'll wait too long. They'll wait for a couple of reasons. Number one, they're afraid of having the surgery. They're afraid of pain. The other thing that patients don't want to do, particularly as patients are getting younger, is they don't want to take months and months off work.
Traditional hip replacement surgery has been a success for many patients, but they often had to deal with a painful and slow recovery. So doctors began to research how to improve the procedure. In the beginning, the requirements for minimally invasive surgery were pretty rigorous. Candidates had to be younger, healthier, at a healthy weight, and especially motivated to have a quicker recovery. Over the years, however, those requirements have changed.
When we first started doing minimally invasive surgery, we're only able to do it on a select few patients. Patients with minimal arthritis, patients who were close to their ideal body weight. As we've gotten better at doing it now in the past 8 years, we do the surgery on absolutely everyone who needs a hip replacement, no matter what their size, no matter what their shape, no matter what.
Minimally invasive surgery requires a smaller incision, usually 3 to 6 inches depending on the patient. The traditional surgery incision is between 10 to 12 inches. Because of the smaller incision, the operation has less of an impact on the other parts of the patient's body.
We don't cut the muscles, ligaments, and tendons. We don't forcibly dislocate the hip. So instead of patients getting out of the hospital in a few days, they're out of the hospital usually in a few hours. Instead of being back to work in a month, they're back to work in a week. Instead of walking around on a crutches or a walker for 6, 8, or 10 weeks, they go home with either nothing or a cane the day of surgery. So that's a pretty dramatic improvement of what we did many years ago.
So look straight ahead.
After surgery, patients are moved to a recovery room for 1 to 2 hours, and then back to their hospital room before discharge. Simone also decided on minimally invasive surgery, but she had both hips replaced, 6 weeks apart, which is the standard time recommended for patients that need both hips replaced.
Everything about the minimally invasive surgery was appealing to me. The recovery time, the fact that they don't cut tendons or muscle. My surgery was at 7 a.m. one morning, and I would have been out of there probably at about 11. It took a while for the pain medication to get out of my system, but once that happened, it was bizarre. You just get up and walk out.
We used to think of hip replacement as being grandma's disease. That's not true anymore. The average age of the patient I operate on now is 52. So I do patients in their 70s, 80s, and 90s, but I also operate on patients in their 20s, 30s, and 40s.
Ted Nielsen, a patient of Dr. Berger's, has suffered for years with arthritic hip pain, but he recently had his hip replaced with the latest minimally invasive procedure.
I'm a very active person. I've always been active all my life. I'm still working 7 days a week. I ride motorcycles. I do everything at my age, so I felt that I wanted to do something that would not take me a long period of time for recovery.
His surgery went well, and within only a few hours he was up and walking with a cane and was able to leave the hospital the same day with minimal pain.
And we're just going to walk right out of here, okay?
It used to be with regular surgery that we had to do physical therapy for patients for months and months, 3, 4, 5, 6 months of physical therapy. Now with this new minimally invasive surgery, since we're not cutting or damaging the muscles, there's much less therapy. We now usually do about 2 to 4 weeks of physical therapy, and they're fully recovered.
Following a physical therapy regimen and pain medications, Ted was able to return to work just a few days post-surgery, managing his motorsports store in Lake Villa, Illinois.
I am in my 8th day right now, being very careful what I do. I'm able to walk without a cane and walk without crutches. I have very, very minimal pain, and I think the procedure went very well.
With less invasive procedures available, doctors say patients can have a same-day outpatient operation and a quicker rehabilitation process. In more traditional hip replacement surgeries, hospital stays can average 4 to 5 days, and patients may require lengthy and more wide-ranging rehabilitation. Simone recovered quickly after her first hip replacement. She was off her cane in 2 days and back to work in 2 weeks. Because of her arthritis in the other hip, she was limited and couldn't return to her vigorous activities like football. So, 6 weeks after her first hip was replaced, she had the other hip done with the same quick recovery. And with at-home physical therapy and a drive to keep up on her exercises, she is seeing very positive results.
I will say I rehabbed next to people that had hip replacements or knee replacements, and I think my success in being able to rehab as quick as I did is that I kept moving, and even if it's not that comfortable because your muscles get fatigued and you're tired and you just don't want to do it, but I had to keep moving.
Early studies suggest that minimally invasive hip replacement surgery streamlines the recovery process, and the long-term benefits of less invasive techniques are currently being studied but show great promise. Patients should be aware that there can be risks involved with hip replacement surgery, although it's low. Serious complications such as joint infection occur in fewer than 1% of patients, and major medical problems such as heart attack or stroke occur even less frequently. However, chronic illnesses may increase the potential for complications, and patients should discuss with their doctors all possible risks. Blood clots in the leg veins or pelvis are the most common complication and can often be prevented with special support hose, inflatable leg coverings, ankle pump exercises, and blood thinners. Other complications such as dislocation, nerve and blood vessel injury, bleeding, fracture, and stiffness can occur. Over the years, hip prostheses may wear out or loosen. The problem will most likely be less common with newer materials and techniques. Newer technologies are leading the way in hip replacement surgery, like gender-specific implants, which are made specifically for either men or women and perform better for younger active patients in most cases.
Not surprising, men and women's hips are different. And there are different kinds of hip replacements now that we use, specifically for men and for women. There are different shapes, there are different canal sizes, so now we have specific implants that we could build inside the hip, that we can put a proper stem in, and then on top of that foundation, build the hip to match the patient's normal anatomy. And that's specific for a man and specific for a woman. The benefits of hip replacement surgery is that alleviates your pain and restores your function. So your hip moves like your normal hip did many years before, but it just doesn't hurt. So it gets rid of your pain, but also increases your mobility significantly and gets you back to enjoying your life.
Simone is back on the football field and is glad she didn't wait any longer than she did.
I feel great today. I feel like I'm glad that I did it at an age where I can still experience quality in my life, and I can still do physical exercises. I'm still a 50-year-old woman, and I still have those limitations, but it's not so devastating that I can't do anything, that I have to sit and watch life go by.
The success of hip replacement surgery depends in large part on how well patients follow their surgeon's instructions regarding home care after the operation. Preventing infection, exercising, proper wound care, and avoiding falls are all essential for a safe recovery. But doctors say it's an exciting time. Their patients are once again moving more freely and getting back to the lives they love with far less pain and disability. That's it for this edition of Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. See you next time.